Hi guys, welcome back to my channel. My name is Ziad, Crohn's disease patient, NHS worker and educator, here bringing you IBD facts and taboo breaking chats. Don't forget to like, comment, share and subscribe on my channel. So let's get started.
Hello and welcome to this lesson on how IBD affects the gut. So what we're going to look at today is we're going to look at some of the intestinal complications of IBD. So first let's start off with abscesses. So people with IBD are likely to develop abdominal or pelvic abscesses throughout their life due to their condition. Now, an abscess is formed when the inflammation of IBD penetrates deep into the wall of the intestine, causing the area to become infected, which results in the formation of pus. This then causes pain and fever to develop and usually requires a small procedure called a percutaneous abscess drainage to be carried out, which helps drain out the pus and treat the infection. They can also be treated by lancing if they appear outside of the body, and further complications of having an abscess is that it can later develop into a fistula. Which brings us nicely onto what is a fistula. So fistulas are abnormal passages that occur either between a hollow organ and another hollow organ, or between a hollow organ and the body surface. And most fistulas in IBD, they occur in the perianal region and connect to the surface of the anus. So how do fistulas actually form? So the way they form is that the inflammation causes damage to the intestinal wall. Now this inflammation is continuous and causes even more damage to the same area of the wall, which weakens it. This causes the inflammation to penetrate deep into the wall and creates a hole or a tunnel. Now, as mentioned, with the inflammation in IBD, it's continuous. So this causes more and more damage to the wall of the intestine and causes the inflammation to penetrate and affect nearby structures, which creates a longer tunnel that connects to the bowel to another surface of the body. Now, depending on the location of the fistula and what it connects to will determine the type of fistula present, of which there are 5 types. So you can have perianal fistulas, which is an anal fistula. You can have an enterovisceral fistula, which is a connection between the bowel and the bladder. You can have an enterocutaneous fistula, which is a fistula connecting the bowel to the skin. An enteroenteric, which is a bowel-to-bowel fistula. And you can have a rectovaginal fistula, which is the bowel-to-vagina connection. There are many ways in which fistulas can be treated by using antibiotics, immunosuppressants, and biologics. In most cases, people will require a surgical procedure for them. So we've looked at how inflammation can affect the bowel, so we're going to look into more detail how this inflammation can cause strictures, obstructions, and bowel perforations. So strictures, obstructions, and perforations, they are all related to each other in the sense that a stricture can lead to an obstruction, which can lead to a bowel perforation. They can all be treated by surgery, and they can be life-threatening complications, so they are very serious if they do occur. So what happens is the inflammation in IBD causes damage to the intestines. Once this inflammation is over, the intestines tries to heal itself. As part of this healing process, it lays down scar tissue where the inflammation was. As mentioned before, the inflammation in IBD is continuous, so this inflammation and healing process and the laying down of scar tissue is continually happening. What this causes is the scar tissue causes the space in the intestine, which is known as the lumen, to become more and more narrow. This is the stricture. Now, the stricture can make it difficult for undigested food to pass through, which can cause pain in some people with IBD. And the more and more this inflammation and repair process occurs, the smaller the lumen of the intestine gets. The smaller and smaller it gets, it can get to a point where nothing can pass through the stricture, and this is known as a bowel obstruction or a blockage. This can be very painful and very serious as it weakens the intestinal wall to the point where it can rupture, spilling bowel contents into the abdomen cavity, which can lead to a life-threatening infection called sepsis. Now, sepsis is also seen in toxic megacolon, and which we're going to look at now. Now, toxic megacolon is a rare life-threatening condition where inflammation causes the large intestine to swell and expand and is so described as a non-obstructive dilation of the large intestine. So no bowel obstruction has occurred in toxic megacolon. It's just a condition where the large intestine swells up to the point where it could rupture. It's usually associated with ulcerative colitis, and it's where gases produced in the large intestine as part of normal digestion can become trapped and contribute to the swelling of the colon. However, it can occur in those with Crohn's disease who have inflammation in their colon. Now, even though it's an IBD complication, there are some uses of medications such as narcotics, as well as the other use of recreational drugs, which can slow down the movements of the intestine, which can allow toxic products to accumulate, which increases the risk of toxic megacolon occurring. Toxic megacolon increases the risk of bowel perforations occurring, which is why the development of symptoms such as high fever, increased heart rate, abdominal pain, and massive swelling of the abdomen should not be ignored. If you do get any of these types of symptoms or are concerned, you should always seek urgent medical help. Another complication that can occur with IBD is something called short bowel syndrome. Now, short bowel syndrome is a condition where the body is unable to absorb enough nutrients from food due to not enough small intestine being available to do this. A person can be classified as having short bowel syndrome if they have less than 180 to 200 centimeters of small bowel remaining, as short bowel syndrome can occur either by damage to the small intestine occurring at birth, requiring the small bowel to be removed, or the inflammation from Crohn's disease being so severe it results in a large portion of the small bowel needed to be removed. Symptoms of short bowel syndrome include diarrhea or steatorrhea, weight loss, dehydration, malnutrition and malabsorption of the essential micro and macronutrients, as well as fluid, electrolyte, and trace element loss. The main strategy of treating short bowel syndrome is trying to maintain the nutritional status of the individual by utilizing the remaining bowel to prevent any further complications. And this is usually done by enteral or parenteral nutritional methods, which we'll look at later on in this course. So to summarize, we've looked at the different intestinal complications associated with IBD.